Well, we want to bring in Republican Congressman Peter King on this discussion. He joins us live right now from Washington. Congressman, what's the Republican take on this?
I was strongly opposed to the bill. The Republicans unanimously were against the bill, as were 34 Democrats. I believe that this was a very damaging and dangerous intrusion by the government into the healthcare system. And I don't think it helps New York at all because, for instance, the new taxes that are going to be imposed to help finance this legislation, New York is only about 6% of the population. We're going to pay 15% of that tax. And that's, I think, the last thing we can afford as we're trying to come out of a recession. It's going to have a really very discriminatory, disproportionate impact on New York, New Jersey, and Connecticut, for that matter.
Congressman, even before the vote was solidified last night, we had heard that Republicans were already planning to make some legal challenges. What do you make of that right now? How's the process going, and is there any merit to it?
Yeah, I think there's a lot of merit to it. Basically, the main challenges that I'm aware of are being launched by the states, by the attorneys general in various states, because this is going to impose a mandate on individuals requiring them to buy insurance. And I'm not aware of any instance where the federal government has ever been able to mandate you to buy something. Now, the states can require you to have insurance, but the federal government, under the Commerce Clause, I don't believe they have the right to require people to do that, and then the states would have to enforce it. So it puts a burden on the states to enforce a plan that's being imposed on individuals by the federal government. So I think there could be a lot of validity to those lawsuits. Also, the Republicans are going to be watching carefully in the Senate to make sure that the Democrats don't violate the rules in that certain parts of the bill that was passed in the House could violate Senate rules because of this backdoor way the Democrats did it, so by trying to avoid a conference between the House and Senate.
Congressman, we have about 10 seconds left. Any doubts that the president is going to sign this later on this week?
No, the president's going to sign it, and I believe we as Republicans, we as Americans, should do all we can to try to repeal it. If not repeal it, certainly strongly amend it in the years to come.
All right, Congressman King, always a pleasure. Thank you. And, of course, our coverage of the health care vote continues. Coming up at 5:30, we'll have...
I'm Don Daly.
And I'm Dana Tyler. The landmark legislation will be signed by President Obama tomorrow at the White House.
Today, we're learning just how much this health care overhaul will cost the tri-state area residents.
As CBS 2 political reporter Marsha Kramer found out, we will pay more than any other part of the country. Marsha joining us now live from the news desk with a closer look. Marsha.
Well, Dana, you can call it a tax, an assessment, a tariff, or a duty. But no matter what words you use, the cold, hard fact is that the new health care bill will hit the tri-state taxpayers in their pocketbooks. We'll pay more than any other part of the country. Over 20% of the entire tax burden is our burden. The additional 32 million Americans who will be covered under the new health care bill should say thank you to us, tri-state area taxpayers, who are footing a disproportionate share of the bill.
In the tri-state area, we constitute 10% of the country's population. We're going to be paying 20% of this new bill in taxes. So that's money going out of the New York, New Jersey, and Connecticut economy and down to Washington.
The combination of a new 3.8% tax on income from interest, dividends, and investments, and a payroll tax of nearly 1% for singles making above $200,000 and married couples making above $250,000 add up to $6.7 billion in new taxes for people living here. New Yorkers will fork over $4.1 billion, New Jersey residents $1.6 billion, and Connecticut residents $1.1 billion.
As Ross Perot once famously said, that giant sucking sound that you hear, in this case, is going to be the health care legislation, sucking a few $1 billion more a year in taxes.
Supporters defend it, saying that the benefits of insuring the uninsured outweigh the extra taxes we'll pay.
Right now, we wind up covering a disproportionately large number of uninsured people in our city, and so as we start to integrate more people into the insurance pools, that means we're going to start saving money.
Opponents say that paying more taxes to Washington takes money out of the local economies, which are already on life support.
That's money that's not going to be spent here in New York. It's money that's not going to be used for producing jobs. It could also cause smaller businesses to move south. This is a lose-lose proposition.
How do local taxpayers feel?
Am I going to like it paying more money? No.
I think it's a good bill, important for the whole country. If taxes can be adjusted in certain ways, that may be a separate problem.
I don't think it's fair. It's just another attempt to, push more of the costs on the people that are wealthier, and people that live in higher cost of living areas are going to bear a greater burden.
Now brace yourselves, because the new taxes dedicated to health care are only the beginning. There's another new tax on those making $250,000 as part of a regular federal budget plan, and the capital gains tax is going up another 5%. Live at the news desk, I'm Marcia Kramer, CBS 2.
This vote last night approving a controversial overhaul of health care in America did not end the battle. President Obama plans to sign that bill into law tomorrow, but opponents are still trying to kill it. The $940 billion plan is projected to extend insurance coverage to roughly 95% of eligible Americans. But state lawmakers and attorneys general are lining up to challenge the bill's constitutionality. Virginia's attorney general announced a legal challenge today, as did prosecutors from 10 other states. We have two reports on this historic health care overhaul. We begin with Government Affairs reporter Melissa Russo and late reaction. Melissa.
Well, Chuck and Sue, the vast majority of New York's congressional delegation voted yes, citing historic changes that'll improve access to affordable health coverage. But some critics today are asking why there was so much support in New York, since, relatively speaking, the health care bill will have less impact here in New York, but cost its residents more.
The long-awaited national health care plan is getting mixed reviews in New York, where many of the reforms are already in effect. Mayor Bloomberg says he'll implement the new law, but he's not enthusiastic about it.
It does not address the total cost of health care in our country. It does not address the fact that we spend double what they do in Western Europe and have a lower life expectancy, but it does address coverage.
It also bars insurance companies from dropping patients when they get sick or refusing coverage because of pre-existing conditions. In other states, those will be big changes, but here in New York, it's already the law.
If you're one of the almost 3 million New Yorkers who don't have health insurance, it's very good news. There'll be many more options, and if you don't make a lot of money, lots of subsidies to help you afford insurance. If you make a lot of money in New York, it's really bad for you.
Individuals earning more than $200,000 and families earning more than $250,000 will pay higher taxes, and there are a lot of those people here in New York.
We will pay a disproportionate percentage of the expenses. I don't think there's any arguments about that.
The New York region, New York tri-state area, is going to end up paying almost 20% of this tax. I think it's going to turn the healthcare system in our country into a massive government-run operation, sort of like the Department of Motor Vehicles, which is the last thing we need.
Governor David Paterson says for at least the next 4 years, the federal government will cover the dramatic costs of expanding Medicaid, which is a good thing for New York State for now.
I endorse it. It does create, at this point, an encumbrance to New York State of about $1 billion in 4 years.
And the governor says he hopes the Senate will find a way to block that $1 billion a year in costs down the road. The mayor, meanwhile, says he's studying just how many billions of additional tax dollars, not only that New Yorkers will pay, but that won't end up being spent here in the local economy, Chuck and Sue, as a result of this new bill.